Leslie, you've called for more birth centers that focus on the hopes, dreams, and aspirations of the communities in which they reside. Can you share a little bit more about what that looks like, specifically in community?
Yes, I'm going to share a short visualization with you. You walk through the door, so happy to receive care at a birth center right in your neighborhood. You, your partner, and your children are greeted by name, maybe even with warm hugs. You're asked how you're doing, and you can tell that the person asking genuinely cares. In the exam room, you feel at home with warm colors and cozy furniture. Your partner feels they belong there too, with ample seating and posters celebrating Black and brown, queer and disabled and trans bodies. Your midwife greets you and you remember how relieved you felt the first time you met, knowing that they were from your community. They welcome the whole family to the visit. Your kids listen to the baby and see them on the ultrasound. Your midwife asks how you've been feeling physically and emotionally, what you've been eating, and how much rest you've been getting. They talk with you and your family about ways to connect with the baby and how to support you. And it's unlike any healthcare appointment that you've ever had. And when it's time to go, you almost don't want to leave. And then a very big difference, another one, is that when you go into labor, there is no frantic rush to the hospital. Instead, your partner calls the midwife, who reminds you what active labor looks and feels like and how to know when it's time to come in. Hours later, you're on your way to the birth center. You walk into your birth suite and breathe a sigh of relief. Your midwife is there and has prepared for your birth journey. You feel loved, knowing that you can labor where and how you feel called to. Your power playlist comes through the speakers while you move and sway and breathe. You walk some, move to a birthing tub. Labor is hard work, yet your surroundings in the birth center are soft and gentle. You feel seen, heard, honored, and supported, easing any concerns that you can't do this. You feel your baby's head emerge. You change positions at will. You're able to respond to the knowing in your body. And when the surges come with more intensity, the newest member of your family arrives in a sacred container of love. And everyone and everything is forever changed.
That is so beautiful.
Thank you.
Completely beautiful.
That is
A beautiful visualization.
we envision.
So, where might that be happening?
Well, we are building the first freestanding birth center in the city of Detroit called Birth Detroit. But around the country, there are a number of other birth centers, about 400 to be exact. The challenge is that very few of those are owned or led by Black, Indigenous, and people of color, which is what is special about the work of Birth Detroit and the work of Birth Center Equity and the 20 birth centers that are open and serving communities of color today, and the 20 other birth center leaders like me who are raising money to open their birth centers.
Wonderful, wonderful. And why is it so important that the birth centers be led by Black, Indigenous, and people of color? Why is that important in communities?
Culturally reverent care matters. The spirit of care matters. How we are seen, listened to, understood, respected matters. And there are studies about culturally congruent care, and some of them are very sad. There's one, for example, that showed that Black infants are more likely to live beyond their first birthday if they are cared for by Black pediatricians.
Wonderful.
Right? And there are also now, on the positive side, studies of birth centers led by folks of color, birth centers that have racial justice values that show greater autonomy and respect and a better experience for people of all races, in addition to being protective for Black and brown people.
Thank you. Thank you for sharing that and the data that backs that up. It's really important. So, what does it take in terms of policy or fundraising to make this happen in communities?
One of the challenges to birth center open is the capital barriers to doing so. The majority of birth centers across the country are for-profit entities, started by midwives, started with funds from private practices, from loans, from family gifts. So certainly not easy for anyone, but as folks of color, we have inequitable access to all of those resources, so tougher on our side. And so Birth Detroit, for example, is a nonprofit birth center model. And we have done a capital campaign to actually raise funds for our land, which we purchased, a new build, which is in progress, and our first 2 years of operations. Right. And so there are birth centers that start like ours with a big fundraising effort. There are others that start with loans or start smaller. Ours was a $4 million raise. And I would say too that the political context, whether or not birth centers are licensed and equitably reimbursed, is critical. Most states around the country license birth centers. There are 9 that don't today. Michigan is one. And so in our work with Birth Detroit, we've had a multi-pronged strategy that has included policy development. And so we have a birth center licensure bill that should be introduced soon. We're very hopeful about it.
Can you share a little bit about the elements of the bill? What are some of the policy barriers or opportunities do you see?
So one of the things at the federal level is the Affordable Care Act, for example. It's written that birth centers are to be reimbursed. Birth centers in states are to be reimbursed. But many states have no regulation that recognizes birth centers without licensure. And so that means that those of us in states like Michigan do not have ready access to that right, if you will, of reimbursement. And so we're working to make that happen. The second piece would be reimbursement. Midwifery care is value-based care. We talk about value-based care and healthcare, and we want to pay for good outcomes, yet we ignore the mountains of data and evidence that say that midwifery care produces better birth outcomes, a better birth experience, and at a more cost-efficient cost to our whole health system. Right? If we paid attention to that, we would reimburse midwifery care for the service and value that midwives provide. So we would reimburse midwives at the same level as physicians for the same service.
I see.
Right? Or higher because they're doing a little bit more work, some might suggest.
Right, right. Tell me a little bit about how you got into doing this work, focused specifically on birth centers.
Yeah. I was a birth doula, which is a non-medical support person for pregnancy, birth, and postpartum when I was a graduate student. And I fell in love with birth before I even had my own babies. I also was a graduate student instructor for a midwife, which is how I learned about midwifery care. And I went into public health. And my first job out of graduate school was as Healthy Start Project Coordinator for the Detroit Health Department. And I worked in local and state public health for a long time. And my last job in government public health was as Deputy Director of Public Health for the city of Detroit. And during that winding road, I got to see what we were investing in, all the work we were doing to try to improve maternal infant health outcomes in the city, some really great work, and no one was investing in midwifery care, right? There was a lack of access to midwives. And it persists today. So today, across the country, less than 15% of folks have access to midwives. When in countries that do so much better than us, it's the opposite. And so knowing that, I became very passionate from a public health perspective about promoting and ensuring access to birth centers for communities of color as part and parcel of the answer to all the problems we say we care about in maternal health today. And I would also share it's very personal to me. I've since had my own babies, one preterm baby, so I've experienced preterm birth in the NICU. I've experienced grief and loss of pregnancy.
I'm sorry to hear that.
I've had a rainbow baby, so we had a reprieve, if you will. And then infant mortality has also impacted my family through my brother and sister-in-law.
I see.
And so when we talk about numbers in maternal health and all of the statistics that we work with in public health, those are not statistics to me.
Yeah.
Those are my babies and my sisters and my family. And we all deserve better.
Yeah, absolutely, absolutely. Thank you for your work. So I know you're part of many other networks of people that care about creating birthing centers and midwives and doulas. Can you share some of those networks that have been important to supporting your work?
Oh, yes. So I am very excited to be an Aspen Ascend Fellow.
Wonderful.
And it has been an amazing journey with the support from the Institute, and my cohort as a network has been phenomenal.
And how large is the cohort?
Oh, I don't even know how large our
Maybe
cohort
about 20
is.
people?
Yes. Yes.
Yeah.
And so I really adore my my peers in my cohort. Also, I would say Birth Center Equity, which is the network we started to support Black, Indigenous, and people of color leaders across the country.
And how large is that network?
There are about 40 of us today. And it has been really great to have that connectivity, even within the larger organizations that support birth centers, like American Association of Birth Centers, to have a group of folks who really intimately know the same challenges you face, and to be able to come together and identify our own needs and assess our own priorities, and then work to access a level of resources none of us could access on our own, has been a game changer. So we've been able to raise and distribute quite a bit of funds to our network since our inception 3 years ago.
Wonderful, wonderful. So I'm going to ask you a couple of questions about recommendations that you have for specific people.
Okay.
So if there is an expectant person that is watching this interview, what would you suggest that they do if they're interested in finding a doula or a midwife? What would you suggest?
I would say start with midwives, right? That midwives are specially trained to focus on the normal physiologic birth process and the reproductive life cycle. They are trained healthcare providers, right? Unlike doulas that are support persons, and that most of us can safely give birth with midwives in a community setting, yet most of us don't know that. So start with midwives, and if you happen to risk out, then seek an obstetrician or physician. And you can have a doula with a midwife or a physician.
I see. Okay, wonderful. Thank you. And what about a policymaker? If a policymaker were listening to this, what would you recommend that they do to take action to support birthing centers?
I would say they should advocate to ensure that birth centers are licensed and equitably reimbursed in their state.
Okay. And what about at the federal level? Any recommendations for congressmen or women or senators?
Yes, I'm full of ideas. But I would say at the federal level, community birth centers should be a large-scale population health strategy to improve maternal infant health in this country, and that we really should reinvest, because our country has intentionally divested historically in midwives. We should reinvest in scaling midwifery care in this country and building community birth infrastructure with community birth centers, and we can improve a whole host of health outcomes and lives with that strategy.
Okay. And what about a philanthropist, someone who's thinking about investing in good organizations or leaders? What recommendations would you have?
I would say give to birth center equity. Give to our network of 40 birth centers and growing, right? Our growing network. We are doing a variety of supports, like emergent need support, but also open doors and keeping doors open support. So helping birth centers to get their doors open, to keep them open. We're also going to be building a back office business studio strategy to help birth centers with startup development, finance, accounting, marketing, business development, efficiencies that midwives typically aren't trained to handle. And we're going to be doing a public education campaign to raise awareness about midwifery and birth centers. And if not birth center equity, I would encourage philanthropists to support their local birth centers wherever they are.
Wonderful. So often we think about birth outcomes from a health aspect, right? And I know that you think very deeply about the economic outcomes of strong, birth centers and practices in communities. Can you share a little bit more about what that means for families?
I really believe that capital should flow in ways that truly support health and well-being. We talk about the concept of beloved economy and how we enter this world matters. And also, when we think about the cost of childbirth in this country, it is very costly and our outcomes are poor. And so if we moved just 1% of our births from hospital to birth center in dollars, we would save annually $189 million is what is financially forecasted. If you increase that to 20% of births over time, by like 2027, the projection is saving $4 billion. Right, of our, within our whole system. And that's not to mention, again, the birth outcomes that are better, the families that are stronger, the surgeries and traumas that are averted. And so we can build a stronger economy looking at and starting from the very beginning and how we do birth. The culture of birth in our country really does need to change.
That sounds like transformation at its highest and most important level. I'm deeply inspired by your work, Leslie.
Thank you.
Thank you.
I'm grateful for this opportunity to talk with you about it.
No, I learned a lot and I appreciate you.
Thank you.